Hi, I'm Matt Hammerton, a GP partner at St Clement's Partnership Winchester and digital primary care clinical lead for Wessex AHSN. I want to talk to you about digital readiness in general practice, but first it would be worth explaining how the research came about. We're all aware of a strong government and policy push for digital transformation within the NHS. Yet, despite this push, the digitisation of healthcare has been slow to develop, with evidence of variation and progression, causing a digital gap and inevitable healthcare inequalities. Digital readiness, defined here as a motivation and competence to effectively adopt, use, and spread digital healthcare technologies, has grown in recognition of its importance for digital transformation. Back in 2018, I took 6 months out to help research, write, and edit the Topple Review, preparing the healthcare workforce to deliver the digital future. This independent report looked at digital readiness on a national scale. When back in clinical practice, I was keen to see how the aspirations of the Topple Review could actually make our lives and our patients' lives easier in general practice. With the support of Health Education England and the HSN, the study was conceived. So why is digital readiness important? Well, technological innovation evolves at a faster pace than some people or practices are ready, willing, or able to embrace, creating a variation in transformation. Digital readiness has a greater impact on digital transformation than technology itself. Yet research into factors impacting on general practice digital readiness is limited. As such, we set out to gain a better understanding by asking, how does digital readiness vary between technologies and the individual aspects of readiness itself? And how do human, practice situation, and external factors impact on digital readiness? We answered these questions using a sequential mixed method format with both quantitative and qualitative evidence between December 2019 and September 2020. Staff at 33 practices within North and Mid Hampshire Integrated Care Partnership and 3 digital companies formed the study boundaries. The technologies considered were electronic patient records, telehealth, patient online access, patient apps and wearables, and social media. Reliably measuring digital readiness in a complex and varied health environment is challenging. As such, we reviewed the literature before developing a 90-second digital readiness online survey tool. This was comprised of 6 user-reported experience measures, including digital competency, contextualized digital competencies, and innovation readiness. COVID-19 presented both problems and opportunities. There were no face-to-face practice visits, and we had to restart the quantitative data collection. However, this allowed us to directly compare quantitative results pre and post-lockdown. We obtained 52 pre and 287 post-lockdown responses, which provided a 22% response rate. The quantitative results determined staff and practice average digital readiness, after which we undertook 6 hours of qualitative interviews with practice staff from different ends of the readiness spectrum, and 3 hours of interviews with digital company staff. The qualitative data was then analysed for emerging themes before being triangulated with the quantitative data. So what did it all show? When considering different technology groups, the results highlighted significant differences. There was a moderate level of digital readiness in long-term technologies such as electronic patient records, but low levels in evolving technologies such as patient apps and wearables and social media, with patient access and telehealth technologies being between the two. This is therefore useful to understand the level of support likely to be needed when implementing different technology implementations, say a new EMIS template versus setting up a closed Facebook group. Furthermore, the use of a simple and contextualized digital readiness assessment tool may help practices to understand and target relevant support where needed when adopting different technologies. For the individual aspects of confidence, motivation, and self-efficacy, previous research talks about the key importance of motivation and professional acceptance. Yet we found self-efficacy, that is perceived capability, particularly individuals' ability to solve problems if stuck, was more of a barrier. And concentrating on this area is likely to bring the biggest reward. For human factors, the data showed that younger general practice staff, those less than 50, those in post for 5 or less years, and non-clinical staff were significantly more competent to several measures of digital readiness. This was especially true with emerging technologies. We also saw that clinical staff, particularly partners, are key enablers of digital transformation, whereas non-clinical staff are critical for patient engagement and troubleshooting. We know that anyone may struggle with digital readiness, and as such, it's important not to stereotype. And we also know that while younger digitally native staff may have better digital skills, older generations are more likely to have better and more refined cognitive skills, with both being important. Yet it suggests the need for understanding differences and targeting digital support appropriately. The results also suggest the need for a supportive team approach with effective communication between staff groups. The simple heuristic tool team routine developed by James Shaw and team may help practices to consider digital transformation in a more service design orientated approach. For practice factors, the results showed significant variation in digital readiness between practices and PCNs. This is in contrast to the interview findings, suggesting a potential complacency in driving forward digital innovation if just looking at surrounding practices. The most significant factor we found was reducing practice digital readiness with increasing a percentage of older patients within a practice population. Less over 65-year-olds in a practice population equals greater staff digital competence. We know digital exclusion is greater in the elderly population, and this may have an impact on practice staff digital readiness. Practice's enthusiasm for change is more likely to be impacted by actual or perceived resistance from less digitally ready patients than by requests from more digitally ready patients. And if practices are to lead digital transformation, they need to enhance learning about and actively support their older patient population digital readiness. This could be via active patient participation groups, patient co-design, and the use of real-time digital usage data, as well as digital staff champions, practice PCM-based digital hubs, and the use of expert patient digital health ambassadors. Another significant finding was smaller, more rural practices demonstrate lower digital readiness scores. The qualitative data emphasised the stark difference in digital readiness between urban and rural practices due to reduced innovation readiness and rural internet connectivity barriers. Interventions to minimise the barriers and support innovation in rural small practices is likely to reduce the digital divide between large urban and small rural practices. Considering external factors, previously suggested enablers, public and professional willingness and clinical endorsement, have been enhanced greatly due to the unique situation of the pandemic. The pandemic has provided significant increases in digital readiness, particularly innovation readiness, telemedicine, and apps and wearables competencies. It can be seen as a great leveler in helping all practices to move in the same direction with a common goal. Yet, in contrast, IT infrastructure, software usability, and interoperability and governance issues were outlined as the main barriers, suggesting these areas, highlighted by previous research, remained unaddressed. While NHS Digital's GP IT Futures may have come at an opportune time for helping to tackle these barriers, going forwards, a critical factor is a collaboration and support gap between technology companies, CCGs, and practices. Accurex's manifesto on software that works delivers a set of principles that would be well worth pursuing to help to reduce these barriers. So, Going forwards, this study has provided pragmatic recommendations for tackling the most pertinent issues. Digital readiness is a multifactorial concept requiring reflection and action from patients, general practice staff, technology companies, CCGs, and governing bodies. A collaborative, formative, and realistic digital readiness checklist that encompasses the above recommendations and provides all stakeholders with clear direction of progression while acknowledging the role each has to play may prove useful. While the pandemic has been hugely damaging to society, it has provided general practice with a unique opportunity to fast forward an empathetic and relevant digital transformation process. General practice staff are motivated in this common goal as long as it is done for the right reasons and appropriately resourced and supported. Please feel free to contact me with any thoughts or suggestions on this. Thank you.